Monday morning, man gets routine PSA test. Result, 6.8. Doctor calls, your PSA is elevated. We need to discuss biopsy. Man panics. Researches prostate cancer all week. Can't sleep, tells family. Friday, goes for second opinion. New doctor orders repeat PSA test before any decisions. Result, 3.2. Same man, same lab, 4 days apart. PSA dropped from 6.8 to 3.2. How is this possible? Monday's test, man had ejaculated Sunday night, rode bicycle to doctor's office, had digital rectal exam before blood draw. All three activities elevate PSA temporarily. Friday's test, abstained from ejaculation 48 hours, drove to appointment, blood drawn before any prostate examination. Result, his true baseline PSA, 3.2, completely normal for his age. Study from Journal of Urology. 28% of men with initial PSA above 4.0 had normal PSA when retested after avoiding activities that temporarily raise levels. Nearly 1/3 of elevated PSA results were false alarms from timing and activities. 7 specific factors can raise PSA without cancer being present. Today, all 7 causes, how much each raises PSA, how long elevation lasts, and the protocol for accurate PSA testing. Now, before we move on, a quick reminder. This video is for educational purposes only. It's not medical advice, and you should always discuss elevated PSA results with your doctor. While many causes are benign, persistent elevation does require medical evaluation to rule out serious conditions, including cancer. And if you'd like a free PSA elevation causes checklist, just comment the word causes below. You'll find the link waiting in the pinned comment. It's a simple guide showing all 7 causes, how to avoid false elevation, and when to retest. Now, let's cover the 7 surprising causes of PSA elevation. Cause number 1, benign prostatic hyperplasia, BPH, non-cancerous prostate enlargement. This is the most common cause of persistent PSA elevation in men over 50. As men age, prostate naturally enlarges, not from cancer, from normal aging process where prostate cells multiply. Statistics: 50% of men by age 60 have BPH, 90% by age 85. Why does BPH raise PSA? Larger prostate has more cells producing PSA? Simple math. If prostate doubles in size, roughly doubles PSA production. Average PSA increase from BPH, 0.04 to 0.07 points per year as prostate grows. Over 10 years, that's 0.4 to 0.7 point increase from aging alone. Study from Prostate Journal, tract PSA changes in men with BPH versus men with stable prostate size. BPH group, PSA increased average 0.65 points over 5 years. Stable prostate group, PSA increased average 0.15 points. The difference, BPH-related growth. How to distinguish BPH elevation from cancer elevation. BPH causes gradual PSA increase over years. Cancer often causes more rapid increase. BPH usually causes urinary symptoms. Frequent urination, weak stream, nighttime bathroom trips. Cancer early stages usually no symptoms. BPH diagnosed through digital rectal exam showing enlarged smooth prostate. Ultrasound measuring prostate volume. Treatment for BPH can actually lower PSA. Medications like finasteride or dutasteride shrink prostate, reduce PSA by 40 to 50%. Important, BPH and cancer can coexist. Elevated PSA from BPH doesn't rule out cancer, but it explains why many men have PSA in 4.0 to 6.0 range without cancer. Cause number 2, prostatitis, inflammation or infection of prostate. This cause can raise PSA dramatically and quickly, sometimes doubling or tripling baseline level. 2 types: bacterial prostatitis from infection, non-bacterial prostatitis from inflammation without infection. Why does prostatitis raise PSA so much? Inflamed prostate tissue becomes more permeable. PSA leaks more easily from prostate cells into bloodstream. Additionally, inflammation triggers prostate cells to produce more PSA. Study from Urology Journal. Men with acute bacterial prostatitis had PSA levels average 8.4. After antibiotic treatment, average PSA dropped to 3.1. That's 5.3-point decrease just from treating inflammation. Symptoms that suggest prostatitis rather than cancer: pelvic pain or discomfort, painful urination or ejaculation, fever if bacterial infection, sudden onset of urinary symptoms. These symptoms unusual with early prostate cancer, which typically causes no symptoms. Diagnosis: urine culture to check for bacteria, digital rectal exam showing tender prostate, sometimes prostate massage to collect fluid for analysis. Treatment: antibiotics for bacterial prostatitis, typically 4 to 6 weeks. Anti-inflammatory medication for non-bacterial type. Timeline for PSA to normalize, usually 2 to 6 weeks after inflammation resolves. Important testing protocol: if prostatitis suspected, treat first, then retest PSA after treatment completes. Research from clinical chemistry. 68% of men with elevated PSA and prostatitis had normal PSA after treatment. This prevents unnecessary biopsies in men whose PSA elevation was purely from inflammation. Cause number 3, ejaculation within 48 hours before PSA test. This is most common cause of temporarily elevated PSA that doctors often don't ask about. Study from Journal of Urology measured PSA before and after ejaculation in healthy men. Finding: PSA increased average 41% within hours after ejaculation. Range: 20 to 60% increase depending on individual. One man with baseline PSA of 2.0, PSA measured 3.16 hours after ejaculation. That's 55% increase. Why does ejaculation raise PSA? Prostate contracts forcefully during ejaculation. This mechanical pressure squeezes PSA from prostate tissue into bloodstream. Prostate also produces fluid during sexual arousal and ejaculation. More active production means more PSA release. How long does elevation last? Most studies show PSA returns to baseline within 24 to 48 hours. Conservative recommendation: abstain from ejaculation 48 hours before PSA test. Some urologists recommend 72 hours to be safe. Real-world impact: man with true baseline PSA of 3.5 has sex night before morning blood draw. PSA measures 5.2, flagged as elevated, triggers anxiety and repeat testing. If he'd abstained 48 hours, PSA would have been 3.5. No concern. Research from European Urology. When men were instructed to abstain 48 hours before testing, false positive PSA results decreased by 19%. Nearly 1/5 of elevated results were simply from recent sexual activity. Important: this is temporary elevation, not harmful, just interferes with accurate testing. Cause number 4, vigorous exercise, especially cycling and heavy leg exercises. Study from clinical biochemistry measured PSA before and after various exercises. Cycling 60 minutes at moderate intensity. PSA increased average 36%, lasted 48 to 72 hours. Heavy squats and deadlifts. PSA increased average 23%, lasted 24 hours. Running, minimal effect, typically under 10% increase. Why does cycling affect PSA so much? Bicycle seat puts direct pressure on prostate. Prolonged pressure causes mechanical trauma, triggers PSA release. Study of competitive cyclists, average PSA 4.7 when tested day after long ride. Same men tested after 1 week no cycling, average PSA 2.9. Heavy leg exercises compress pelvic area, create pressure on prostate. Similar mechanism to cycling, but less pronounced. Recommendations for accurate testing: avoid cycling 48 to 72 hours before PSA test. Avoid heavy squats, deadlifts, leg presses 24 hours before test. Light exercise like walking. No significant effect. Real-world scenario: active man rides 30 miles Saturday morning. PSA test Monday morning. PSA elevated. Anxiety and concern. If he'd known to avoid cycling before test or schedule test on different day, result would be accurate baseline. Cause number 5, urinary tract infection, UTI. Bladder or urinary tract infections can cause inflammation that extends to prostate, raising PSA. Typical PSA elevation from UTI, 1 to 3 points above baseline. Symptoms that suggest UTI: burning during urination, frequent urgent need to urinate, cloudy or strong-smelling urine, sometimes blood in urine. These symptoms make UTI easy to identify as cause of PSA elevation. Diagnosis: simple urinalysis and urine culture. Treatment: antibiotics, typically 7 to 14 days. Timeline for PSA to normalize: 2 to 4 weeks after infection cleared. Testing protocol: if UTI present when PSA elevated, treat infection first. Retest PSA 4 weeks after treatment completes. Study from Journal of Clinical Microbiology: 82% of men with PSA elevation and UTI had normal PSA after infection treatment. Important: don't get PSA test if you have urinary symptoms suggesting infection. Treat infection first, then test. Cause number 6, recent prostate examination or urological procedures. Different procedures affect PSA differently. Digital rectal exam, DRE, minimal effect. May raise PSA 10 to 15%. Returns to baseline within hours. Cystoscopy, moderate effect. Can raise PSA 1 to 2 points. Takes several days to normalize. Prostate biopsy, dramatic effect. Can raise PSA 10 or more points. Takes 4 to 6 weeks to return to baseline. Transurethral procedures. Significant elevation lasting weeks. Study from Urology examined PSA timing after procedures. Finding: PSA should not be tested within 6 weeks after prostate biopsy, within 2 weeks after cystoscopy, within 48 hours after digital rectal exam. Common mistake: doctor performs digital rectal exam, then orders PSA blood draw same visit. The exam itself can slightly elevate PSA. Better practice: blood draw before any prostate manipulation. Important for scheduling: if you need both PSA test and procedures, get blood drawn first before any prostate examination or procedure. Cause number 7, certain medications and supplements that affect PSA. Testosterone therapy or supplements. Testosterone can stimulate prostate growth, increase PSA production. Study from Journal of Clinical Endocrinology. Men on testosterone replacement had average PSA increase of 0.8 points over 1 year. This doesn't mean testosterone causes cancer, just stimulates prostate tissue, including any existing cancer. Finasteride and dutasteride. These medications actually lower PSA by 40 to 50%. Used to treat BPH, shrink prostate, reduce PSA. Important: if taking these medications, your PSA should be roughly half your baseline. If PSA rising despite medication, concerning. Some herbal supplements. Saw palmetto. Studies show minimal PSA effect despite prostate benefits. High-dose vitamin E or selenium. Some studies suggest slight PSA increase. Anabolic steroids can significantly raise PSA. Important for discussion with doctor. Always tell doctor about all medications and supplements when PSA elevated. Medication-related PSA changes usually gradual over months, not sudden spikes. Let's recap the 7 causes of PSA elevation without cancer. 1. Benign prostatic hyperplasia, BPH. Most common, gradual increase over years. 2. Prostatitis, can raise PSA dramatically, resolves with treatment. 3. Recent ejaculation, 40% increase, temporary, 24 to 48 hours. 4. Vigorous exercise and cycling, 20 to 40% increase, lasts 24 to 72 hours. 5. Urinary tract infection, 1 to 3 point increase, resolves with antibiotics. 6. Recent medical procedures, varies by procedure, can last weeks. 7. Medications and supplements, testosterone raises, finasteride lowers. The protocol for accurate PSA testing: no ejaculation 48 hours before test, no vigorous exercise 24 hours before test, no cycling 48 to 72 hours before test, no urinary tract infection symptoms. If present, treat first, test later. No prostate procedures within 6 weeks. Blood drawn before any digital rectal exam. If PSA elevated on first test, don't panic. Repeat test following protocol above. If PSA remains elevated on properly timed repeat test, further evaluation appropriate. PSA velocity analysis, possible MRI, discussion of biopsy if indicated. Important perspective: Elevated PSA is not diagnosis. It's indication for investigation. Investigation often reveals benign cause from list we covered today. Study from American Journal of Medicine. Among men with initial PSA 4.0 to 10.0, 42% had benign cause when properly evaluated. Understanding these 7 causes helps you work with your doctor on systematic approach rather than immediately assuming worst. Remember, comment causes for your free PSA elevation checklist. If helpful, tap like and share with men navigating PSA concerns. Subscribe because next week we're covering the new biomarkers that are more specific than PSA for detecting aggressive prostate cancer. 7 causes. Most benign. Most preventable with proper testing protocol. Your PSA. Your timing. Your informed testing.